Tate Chronicles now transmitting.
Welcome to the Tate Chronicles on Healthcare Now Radio. And now, here's your host, Jim Tate.
Good day, citizens of the free world, from border to border, coast to coast, and to all the ships at sea. I bring you a warm welcome. This is your correspondent, Jim Tate, and thank you for tuning in today to the Tate Chronicles. Join me as we cut through the fog that exists at the leading edge of healthcare technology and processes. I'm very pleased today. My guest is Peyman Zand. He is the Vice President for Strategic Services for CereCore. CereCore provides healthcare IT services such as EHR implementation, staff augmentation, and clinical and technical support to hospitals. Peyman is a health IT veteran, previously served as a Vice President, Community Health Systems, and Regional CIO for Tenet Healthcare. Peyman also currently leads the advisory services divisions at CereCore, and there he works with hospital and health system leaders to deliver specific and measurable results through a methodical approach to strategic planning and project execution. Peyman, welcome to the show today.
Jim, thank you very much for having me.
Really pleased. Our topic today is extremely relevant: how to prepare for health IT transitions and transformations in 2021. I can really think of no one more relevant to add to the discussion than you. And I just want to say that the current volume of necessary transitions in healthcare organizations is immense. In normal times, we would still have a lot to do in typical transitions, like moving from one EHR system to another. But now with COVID, we've got these out of the blue transitions that have just been dropped on healthcare systems because of the pandemic, such as how to increase use of telehealth and other virtual applications, and how to support those remote workforces. So much going on. I know you have recently conducted a forum with quite a few of the CIOs that are members of CHIME earlier this year. I'd like to know, what are some of the priorities these CIOs brought forth to you during that forum?
Yeah, I appreciate that, Jim. So we have, as you mentioned, several different discussions with these CIOs. The CHIME CIOs through our 4 times a year, I think 3 or 4 times a year, we have forums that we host with them. And then we have our own CIO cohort group that is another 40 or so CIOs from across the country. And we also have conversations with them on a regular basis. And we also send out surveys to ask these questions. And to your point, there's been, we're going to call this thing a transitional year, because to your point, if we think about the scope and the scale with which we rolled out telehealth, it's nothing less than remarkable. But that also created a bit of a shift in the executive suite thinking, right? That if we could roll that out so quickly, can we do the same thing for other services? And the short answer to that is obviously yes, but then the deeper answer to that is that what are some of the things that were missed, for example? Were there proper planning or governance and a bidirectional communication, et cetera? So some of the work that has been done in telehealth needed to be revisited by a lot of the CIOs and their teams to go back and retrofit some of these things. Well, we asked the CIOs, what are some of their top priorities now? And that was really interesting. Their number one, actually, believe it or not, which didn't surprise us, was cloud migration. But in that cloud migration, about 60% of them said that. But in that cloud migration, they did not think of cloud migration as moving everything to the cloud. It was more of a hybrid environment. And we understand that. So the scale and the speed at which they moved to the cloud was slower. And that's primarily because of the cost. Their second one was introducing or supporting these new services as we talked about. So telehealth services. Now they have, in some cases, 40-50% of their patient visits are being done through telehealth. So that requires a whole slew of new service provisioning and service desks for helping the customers, clients, et cetera. And if you think about the teleworkers, a lot of their employees are now working from home. They need those services as well. So that was number 2, was providing support for those services. Our third and fourth didn't surprise us and came in at a tie between M&A activities and IT asset consolidation, application rationalization, and in general, IT optimization, reducing costs. Because if you think about it, adding telehealth services and other services increases your cost. So they're looking at that. And what surprised us and what didn't make the list was outsourcing capabilities. They talked about it in more of a co-sourcing arrangement, meaning that they would find application managed service providers to come in and help, but then co-source, meaning that they would combine them with their own teams. But that didn't even make their top list for the 2021. And so that kind of wraps up our conversation with the CIOs and what their priorities are going into 2021.
You know, one thing that didn't make their top list, but I'm sure was an area of concern, I'd like to get your thoughts on it. From the period maybe sometime in March, but definitely April, May, and June, all these hospital systems essentially stopped elective admissions and procedures. And how did these organizations, and was there a need for response by the CIOs to do something to help bridge that gap? Was that part of their mandate or their approach to just the financial side of things for the whole organization?
Yeah, great question, Jim. Not specifically in that sense, but what we did talk to them about was leveraging these advanced technologies to be able to help them in not just the predictions of what the patients need, but also helping the patients, patient engagement, et cetera. And in that sense, they did talk about that they wanted to actually leverage predictive analytics or prospective analytics quite a bit more. So today, majority of probably, if not all of them, majority of the healthcare organizations have retrospective analytics. They can tell you who came into the door, what percentage of people, what percentage of what specific gender or race, et cetera, was impacted with COVID. They can give you all that, but that's looking at data historically. Looking at data going forward is much different. And this is actually opening the doors to a number of new entrants into the healthcare industry that have abilities for prospective analytics, artificial intelligence, and other means to help them identify what patients might be requiring and needing, which, by the way, this should help them identify those elective surgeries that have been postponed or those other health needs that the patients might have. And in fact, it would help them it would help all of us in the move to the value-based care, which we've been kind of stymied for a long time because of the lack of technologies that we have and the incredible cost that's associated with it. So I think in that sense, we are seeing these advanced technologies coming into the market to help the CIOs with that.
And, that's an area that really hadn't been discussed much lately, and I'm glad you brought it up. All these delayed healthcare is not just pushed to the side. It's going to cause problems down the road, or, delayed doesn't mean denied. Those so-called elective procedures are still going to be performed at some time. And you mentioned advanced technologies. And so based on your discussions with the CIOs, can you provide some insight in the trends that we might expect in 2021?
Certainly. So one of the other questions we asked the CIOs, both in our in-person or I guess virtual nowadays forums, as well as surveys that went out, was their future plans. As I mentioned, the advanced technologies and patient engagement technologies, AI, et cetera, came up high on their agenda. In fact, of the respondents, 60% of them said that that's what they wanted to concentrate on. What we're seeing, for example, is if you think about how you use the Google Maps, when you get in your car, you start driving, and it gives you information about traffic or accidents or other types of information. That mapping information is getting its data from several different sources, not just one, right? It's getting it from other drivers that have their cell phones on, so the identified data that gets transmitted back to cell towers and back to the Google platform environment. And then you can find out that this individual was traveling at 70 miles an hour before, now they're traveling at 30, so there must be a traffic pattern. Police data and other types of data. In fact, in some better ways, they're actually integrating it with weather and other types. That sort of technology from players like Google and SAS and a lot of product providers, et cetera, are coming to the market and are beginning to actually provide this information to the CIOs, to the healthcare providers, and that will help them identify where the patients are coming from, when they might be coming from, travel data. All of that information can be incorporated into that, and I think we're going to get to that. But the underlying point of all of that is the fact that we're going to finally make the interoperability a reality, because we have to. Think about all of these systems have to actually work together. In fact, our ERP and our EHR systems have to work very closely together, which in the past have not been. There's more of an HL7 or some sort of an integration or interface, I should say, between the two systems that is retrospective information. So to know that you have X number of patients coming in and that you have, for that, you need additional PPEs or other surgical devices, et cetera, that's really where we're going with this one. So I think that's where the majority of the concentration is going to be over the next few years. In fact, I wouldn't be surprised if we see some new entrants into the EHR ERP environment to provide more of an integrated solution in that space.
Peyman, how did you see these priorities change with the COVID-19 pandemic, and what are you seeing now?
Obviously the COVID forced us into an environment that we couldn't imagine before, that we could actually roll out some of these things, and we were able to do that. That was, I think, the hats off to the CIOs around the country that were able to step it up. And not just the CIOs, by the way, there's a lot of the service providers that really work tirelessly to actually make sure that this is happening. But another thing is happening as well, which I need to bring to the attention of your listeners, is the other new entrants into the market. And these are the new players such as retail giants like Amazon and Walmart and Sam's Club. We've heard in the last couple of weeks some really interesting news from Walmart providing healthcare, primary healthcare to folks for about, I think, something like $33 a quarter and or $25 a month, something like that. Some really low numbers. Sam's Club is providing a $1 telehealth visit. Again, these are primary visits. These are not, specialties, et cetera, but they are beginning to actually get into this market. Amazon just announced their pharmacy, their retail online pharmacy that they're rolling out. And so we're beginning to see that a new breed of players, as I mentioned before, these advanced technologies like AI and analytics, as well as these players such as Amazon's and Walmart's are getting into there. What all of that means for the CIOs is that they have to think very differently than they did before. They have to accelerate their trajectory or their changes that they're going to be dealing with. So in fact, to that point, the telehealth was the tip of the iceberg. In fact, the other changes that are coming are going to dwarf the scale of what we went through with telehealth. All of that is actually really good news for healthcare. In general, if you think about what Amazon did to the retail industry, they actually lowered the cost and made it much more convenient. The same things are going to happen within the healthcare environment. And that puts actually the traditional or the legacy-based systems and applications at a bit of a risk, because those cannot necessarily help the organizations make the transition to this new environment. So that's why I said that we're probably going to see new players in the ERP HR space to either redo or rethink about how they do work together going forward, or new entrants are going to come into the market.
Peyman, what I hear you saying is that over the next 5 years, we're probably going to see more transformation and transition in the entire healthcare delivery space than we've seen in the last 5 years. So the trend is only going to accelerate. One thing you kind of touched on is e-workers or remote workers. I've got a neighbor who works at Duke, the Duke hospital system there in the pharmacy department, and they are totally virtual now. They do their work from home. I'm not sure what part of the pharmacy they work in, but they used to go to Duke every day and work in the pharmacy there. And so many healthcare systems went to a virtual model as much as they possibly could because of the risk of COVID-19. Do you think that's going to kind of continue, or is everybody going to go back in the building? How do you think that's going to work out?
Yeah, good question. I think part of it still remains to be seen to see how we actually react post-COVID. But I do believe that the best information that we have and that we've seen from our own sources and other sources across the nation is that roughly, if you think about telehealth, just to stay there for a minute, telehealth was less than 10% of the visits at best before COVID. It's at about 40, well, it went up to about 60%. It's roughly about 40% now. We think it's going to stay there. The remote workers, those workers that could work remotely, 100% of them went remote. Some of them are coming back. We think actually it's going to be about 40% as well, meaning that once we go forward, about 40% of the workers are able to work remotely. You know, one of the things we asked the CIOs about that, they said that they were a bit concerned about productivity, but about 70% of the CIOs mentioned that the productivity actually had increased. So there was better productivity for the employees working from home. And about 20% of them said that productivity remained the same. About less than 6% of them said that their productivity decreased. So if you think about that 70-some percent, 80% saying that the productivity either increased or remained the same, that gives them the comfort and the confidence that they can have their employees work remotely. And for that reason, we think that roughly about 30-40% of the employees will continue working remotely going forward.
One of the things I'd be curious to get your opinion on, your comments, because you speak with so many CIOs and gather data from them, the issue of lessons learned and best practices. Now, of course, it's great to be able to have time to plan a transition. But as we've learned from the pandemic, sometimes you don't have time to plan. You just have to act. And we don't know what's ahead in 2021. I imagine a lot of hospitals don't even know if they're going to be involved in the actual vaccination of hundreds of millions of individuals. We don't know what 2021 is going to be. But what are some of the best practices these CIOs should focus on now as they hopefully head towards smoother transitions in 2021?
Yeah, that's really a very good point, because what happened as a result of the telehealth and telecommuters increasing dramatically, that, by the way, increased the CIO's costs even more. So they were already under a cost pressure, and that increased their cost more. And so now they have to deal with that. And by the way, those major projects that they had, whether it was replacing legacy systems or upgrading their aging infrastructure or operating environments that needed to be done, or the threat of cybersecurity attacks that continues to escalate, those didn't go away. So those priorities remained, and these new priorities were added to their list. And yet at the same time, we heard from majority of their CIOs that because of the reduced number of elective surgeries, et cetera, and cost reductions were actually even escalated. So they actually were asked to reduce their costs, reduce their operating costs and their capital costs by about 10 to 20%. So put all of that together, the best practices going forward actually kind of forces the CIOs into a number of different fronts. One is absolutely no options but to rationalize their application and their infrastructure environment, meaning to go down to a number less than what they have today, number of application and infrastructure less than what they have today. That is going to be not an option going forward. So that's one. The other one is actually taking a look at their internal resources. In fact, we have a number of projects kicking off with a number of our clients that are looking at their organization and optimizing those organizations for much better cost as well as support provisioning. So these are the types of things that are going to be forefront, and that's going to actually force, this is going to be the uncomfortable side for the CIO. It's actually going to force the CIOs to do things that they're not used to. When they roll out a new EHR system, they're used to sending hundreds of people, 200, 300, sometimes people to get trained, building that support structure, et cetera, et cetera. And those costs are no longer sustainable. Now, other industries, by the way, I should mention, other industries, manufacturing, finance, et cetera, went through this pain years ago, right? Manufacturing years ago when it was being outsourced to the overseas. Financial sector went through a couple. Last of the one was the 2008 era that they had to go through quite a bit of cost reduction and be much more nimble, much more streamlined. This is happening in healthcare now. And now we're forced into these streamlining opportunities, which will be painful in many cases, brand new territories in other cases for CIOs that haven't done this thing. And but it has to be done because otherwise it's non-sustainable. They can't roll out all the things that we just talked about, the AIs and the advanced technologies, et cetera. They can't roll those out unless they get some of the costs out. And by the way, it's not all doom and gloom. Has been done in other industries. It can be done in healthcare industry, and it will be done in healthcare industry. And I believe that at the end of it, to your point, in about 3 to 5 years, we'll come out of this thing a much better industry than we were in 2000 or even 2019.
Peyman, one of the things I'm aware of is that when the pandemic first hit, there was immediate response from CMS and the Office of Civil Rights to allow some relaxation of enforcement of HIPAA standards. There was increased reimbursement, kind of make parity with telehealth, with face-to-face visits. And some of those are expected to expire when the national emergency is declared over. Some may stay, some may be rolled back. So we don't know about that. How that's going to go, but that's a big transition, just a regulatory transition they have to keep their mind on, because some things are going to, it's like the tide came in and some of the tide's going to go back out. I imagine in 2021, we'll see some adjustments and modification there.
I agree, Jim. I have a comment about that. I think what's going to happen, so we relaxed some of the HIPAA requirements, to your point, just to be able to get through the hurdle here. But I think what we're going to do is we're going to come up with new rules and new policies that will replace those relaxed rules so that we actually have them, because CMS knows that telehealth isn't going away. CMS knows that interoperability now takes front stage and needs to move forward. So they're going to make some changes, policy and other types of regulatory requirements that will replace those relaxed rules so that it can actually work finally. So I think we're going to do a much more intelligent approach to these.
Tell me who are the clients for CereCore? Who are the organizations that you help?
Today we have roughly around just about 40 different clients. These include large companies, obviously our HCR parent company, to CHS, Community Health System, LifePoint, Ardent. And so those are some that come to mind. I don't have the list in front of me, but these are some major healthcare systems that represent roughly around 300 plus hospitals and facilities that we support today. We have, I think, about 600, roughly about 600 internal employees that support these, and about 100, we support over 160,000 users. So this is where we see some of these trends and have the ability to do that.
And so you really focus on those hospital systems, other healthcare entities that are pretty broad in scope, it sounds like.
Primarily, that's our focus right now is the provider space and hospital and some large physician office practices, et cetera, but in general it's the provider side of the house.
Exactly. One other question about that, if somebody wants to find out more about CereCore and your services, how could they find that out?
Well, obviously, happy to provide my contact information. They can contact me directly. Peyman.Zand@CereCore.net, or go directly to our website, CereCore.net. There is plenty of information on that site. We actually have quite a few LinkedIn and other types of information that we post out there through social media. So that should be just typing in CereCore should come up with a whole bunch of those. But again, I'll be happy to talk to folks, and this is how I get my juices flowing. So, and this is the rest of my team at CereCore.
You know, I was on the CereCore.net website earlier today, and there's some really good educational and informative blog posts there. So I recommend everybody to go to the website. Well, unfortunately, we're totally out of time today. I'd like to thank the audience for joining me on this episode of Tate Chronicles, and I offer a special salute to my guest today, Peyman Zand of CereCore. Peyman, thanks for coming aboard today.
Thanks again for having me, Jim.
You can find more information about CereCore at their website, CereCore.net. That's CereCore.net, CereCore.net. You can find more information on this show's program page at healthcarenowradio.com. Until we meet again, here's wishing you smooth sailing and safe harbors.
Tate Chronicles transmission ending now.